When most people think about eating disorders, conditions like anorexia, bulimia usually come into mind. But ARFID is different, and it goes way beyond just being a picky eater. If you or someone you know struggles with extremely limited food choices, intense fears around eating, or significant nutritional concerns that aren't related to body image, this video is for you. Hi everyone, welcome back to my channel. I'm Dr. Dona, youth and adult psychiatrist, here to discuss all things mental health and wellness related. Today we're going to talk about something that doesn't get enough attention in discussions about eating disorders, and that's ARFID, or Avoidant Restrictive Food Intake Disorder. Before we dive in, hit that subscribe button if you're interested in more mental health content, and let's get started. So what exactly is ARFID? The acronym stands for Avoidant Restrictive Food Intake Disorder. It's a relatively new diagnosis in the DSM-5, our diagnostic manual for mental health conditions. Unlike other eating disorders like anorexia or bulimia, ARFID isn't driven by concerns about weight or body shape. People with ARFID restrict or avoid food for completely different reasons. Let me break down the key characteristics. First, people with ARFID often experience significant nutritional deficiencies because of their restricted eating. This can lead to weight loss, growth issues in kids, or dependence on supplements. Second, many individuals with ARFID avoid certain foods because of specific fears, like choking, vomiting, or having an allergic reaction. Third, some people might have intense sensory sensitivities. Certain textures, smells, colors, or tastes can feel genuinely overwhelming or intolerable. And fourth, and this is really important, people with ARFID don't restrict food because they're concerned about their weight or body image. That's a key difference from other eating disorders. Let me share some examples of what ARFID might look like in real life. Imagine a 10-year-old who will only eat plain pasta, certain brands of chicken nuggets, and apple slices with the skin removed. Any attempt to introduce new foods leads to extreme anxiety, gagging, or meltdowns. Their pediatrician is concerned about their growth and nutrient intake. Or consider a college student who had a scary choking incident at a restaurant, and since then they've developed an intense fear of swallowing and will only eat soft foods like yogurt, mashed potatoes, and smoothies. They've lost weight and often avoid social gatherings involving food. Or an adult who can only eat foods that are separated on the plate. Nothing can touch. They have specific routines around eating and become extremely distressed if their food doesn't look or feel right. They maintain adequate weight, but their diet lacks variety and essential nutrients. These aren't just preferences, these are significant restrictions that impact daily life, health, and social functioning. Living with ARFID can be really challenging. The impacts extend far beyond just meal times. Physically, chronic malnutrition can cause fatigue, weakened immunity, digestive problems, and in children, delayed growth and development. Some people might even need nutritional supplements, or in severe cases, feeding tubes. Socially, think about how many of our gatherings revolve around food. Birthday parties, holiday meals, business lunches, dates, etc. For someone with ARFID, these events can trigger intense anxiety. People often report avoiding social situations entirely or developing elaborate excuses to avoid eating in public. And mentally, living with ARFID can be exhausting. There's the constant worry about what food will be available, anxiety about trying new things, and sometimes shame or embarrassment about their eating habits. Many people with ARFID also experience depression and anxiety disorders. People often ask me, what causes ARFID? The truth is, there's rarely a single cause. We typically see a combination of factors. This can include genetics and temperament that play a role. Some people are simply born more sensitive to sensory input or more prone to anxiety. Traumatic experiences around food can trigger ARFID. Things like choking, severe food poisoning, or a frightening allergic reaction can cause this. We also see ARFID more frequently in people with certain neurodevelopmental conditions like autism spectrum disorder or ADHD, when sensory processing differences are common. And sometimes ARFID develops gradually from what starts as typical picky eating in childhood but doesn't resolve as expected. What's important to understand is that people don't choose to have ARFID. It's not about being difficult or seeking attention. These are real physiologic and psychologic responses that can be incredibly distressing. So how is ARFID diagnosed? As a psychiatrist, I work with a team that typically includes a primary care doctor, a PCP, a pediatrician, dietitian, and sometimes a psychologist. We look for significant nutritional impacts, substantial interference with social functioning, and confirmation that the reaction isn't related to body image concerns or cultural practices around food. Now, for the good news, ARFID is treatable. Treatment usually involves a multifaceted approach. Cognitive behavioral therapy, or CBT, helps address the thoughts and behaviors around feared foods. There are specifically adapted versions of CBT specifically for ARFID. Exposure therapy involves gradually introducing avoided foods in a controlled, supportive environment. This isn't about forcing someone to eat everything, it's about slowly expanding their comfort zone. Nutritional counseling is crucial to ensure the person is getting adequate nutrition while working through the treatment. For some people, especially those with high anxiety, medications might be helpful as part of their treatment plan. And family-based approaches are particularly important when working with children and adolescents. Parents need tools to support their child without mealtime becoming a battleground. The specific approach depends on the individual's age, the severity of their ARFID, and what factors are maintaining their eating challenges. If someone you care about has ARFID, here are some ways that you can try to help. First and foremost, be patient and understanding. Pressuring someone to just try it or saying it's just food isn't helpful and can actually make things worse. Create a low-stress eating environment and avoid commenting on what or how much they're eating. Keep conversations positive during mealtime. Don't make separate meals for everyone, but do try to include at least one food that the person is comfortable with at each meal. Celebrate small victories. Trying even a tiny amount of a new food can be a huge step for someone with ARFID. And perhaps most importantly, encourage professional help. Recovering from ARFID usually requires specialized support. If you're struggling with ARFID yourself, please know that you are not alone and it's not your fault. With the right support, people can expand their range of foods and develop a healthier relationship with eating. If you suspect someone you care about might have ARFID, approach the conversation with compassion and focus on the impact their eating is having on their life, rather than criticizing their food choices. I hope this video has helped you understand ARFID a bit better. If you have questions, drop them in the comments below, and if you'd like me to cover other mental health topics, let me know. Thanks for watching, and I'll see you in the next video. Take care.